I'm going to start back with I asked you a question. You've been in reproductive health for a long time.
Yes.
And how did you get into this? And why did you end up going to vasectomy as part of this?
It's funny because I've been in reproductive health for a long time, but that's because reproductive health is part of family medicine or general healthcare and being a healthcare provider, clinician. And so basically, when I decided to go into medicine and in medical school, a group of us, a group of people in my medical school who were students, took over and did this side curriculum and did this. It was through the Med Students for Choice organization, and they created a side set of series of lectures around sexual and reproductive health so that medical students could learn more than we got in the standard curriculum of medical training about sexual and reproductive health. And then when I went into family medicine, it was always important. I chose a program to study in that incorporated sexual and reproductive health, abortion care, all things related to miscarriage management and birth control, and all things done in the primary care setting. I chose a program that incorporated what we called full spectrum reproductive health care into my basic training right out of medical school. And during this time, I tried to get trained to do vasectomies and was unable to get training to do vasectomies during residency. There were two people who did training, and they happened to do vasectomies infrequently and on a day when I had other things that I was required to do. So I saw zero vasectomies during my 3 years of residency. And then I
In
did
reproductive health. Yeah.
in family medicine, which incorporated, right, full spectrum reproductive health. And then so I did a 2 years extra training to become a fellowship in family planning, to become a so-called specialist in family planning. And during this fellowship, I was told, literally the words came out of the people who funded it, their mouths, that vasectomy was not at that point to them considered family planning. And so
Whoa.
I had to take it upon myself, and with the support of my fellowship director, to find Doug Stein and Michel Lebrecq, and I went and got to spend time studying with Dr. Stein and Dr. Lebrecq, and learned the basics, and from the beginning, aside from stuff that I'd sort of read in books from them. So that was, and it was because of the effort that it took for me to be able to get myself trained, and I was very lucky to be trained well and by some of the best people all over the world, and with some of the best people all over the world, that it became sort of solidified in me that it was important and a mission of mine to make sure that we had services for people with of all genders, including men, in reproductive health. And so that's why when I moved back to Massachusetts in 2018, I decided that it was time to just open a practice that focused on vasectomy and promoting vasectomy services and breaking down some of the barriers to access for all people.
Well, and how long did it take you to get really good at being a vasectomist?
Mm, I think I'm still working on it, is one answer. Um, I felt like I did it in fits and starts. Like I got to like get some really excellent early training with Dr. Stein, who makes it so you can really focus on, like, step by step, a full case with patients who are very informed about it. So I got a good foundation with, like, the first four cases that I did with him, and seeing him do some other procedures. And then I spent a month in doing vasectomies with another provider. And I think that by the time I felt like I was ready to sort of go out on my own, I had done 39 vasectomies. And I don't know if I would call myself good, but I felt like I could do them. And I felt like if I pre-screened guys and had patients who were, willing to have me take as long as I needed, and I knew that they had, amenable anatomy, that it would be something that could be done. And then I went on a couple of trips with No Scalpel Vasectomy International, and it was at the end of the first trip. I think we did, like, there was a day when I think I did like 26 vasectomies in a day or something like that. And by the time I was done with this trip, I was like, anyone, bring anyone to me, bring them all here. And but still, yeah, still, we're always still learning. You think you can do really well, and then someone walks in that challenges you, and
Yeah,
that's part of what makes it interesting, I suppose.
a bit of scrotal variety out there.
Bit of scrotal variety, yes.
Well, so at this point, do you think that there is a gold standard for the vasectomy that you would, like if you had to spread the word that there's a gold standard that you would describe?
Interesting, because you and I have talked about this.
It's true.
For a gold standard, I mean, number one, people want a vasectomy where they are treated respectfully and where it works well. So I think like that's what we need is people that don't have to pay a lot or travel far in order to get a quality vasectomy.
Mm.
If you're talking about gold standard, I firmly believe that vasectomies should be pain-free. And when I train other people, I tell them like there's lots of different ways to make people comfortable, but this is a procedure that for almost everybody, we should be able to give them enough anesthesia that it works so that it's pain free. And then you want to have an excellent outcome. Like really, it should fail less than 1% of the time. So I use the no scalpel technique to get to the tubes. I use a combination of transection of the vas, intraluminal thermal cautery, and fascial interposition. And I've gotten the results so far that we're supposed to. A very, very low failure rate and very happy patients.
That is the measurement, it's really happy patients and the
Yes.
word spreads because I know that the word is spread about you a lot. And in part because you also work on transgender people, which
Yes.
not everyone is so open for. I think and what percentage of your practice would that be? Probably not high, right?
Hmm. My guess would be, and without looking at the numbers, it feels like it reflects society as a whole. It's interesting because traditionally people who seek vasectomy services or are able to get them are not a heterogeneous group that are not representative of the population at large. And so I certainly found the places that I work that I have regularly, like every month, like more than one person who is not using he him pronouns, that whether they're non-binary or female or they them is but yes, I don't know if there's like I know I'm on some Reddit discussion groups for providers who are happy to see younger people or people without children, and that I'm open for that. Um, but I don't know if the word has gotten around or it's I've tried very hard to make the wording on my materials gender neutral. For example, like instead of saying vasectomy is permanent birth control for men, I just say vasectomy is permanent birth control. And I feel like if people can't figure out that if they don't have testicles, a vasectomy is not for them, they we can help explain that. And we have other options. So
Well, that's the educational component of what you do, that and counseling. And of course, by the time people are seeking a vasectomy, they probably know something about it. I would still think that a component of what you do is counseling and is education, even if it's the partner that maybe not doesn't know the whole story.
Absolutely. Absolutely. I put a lot of information out front. A lot of people, more and more people who come to me seem to be talking to their peers and colleagues sometimes and
Mm.
have a lot of information about vasectomy before they come in. And the way that I've set up my practice, there's a lot of information that's shared ahead of time just in writing. And sometimes people walk in and I say, do you have any questions for me? And they say, no, I have had all my questions answered by the materials that I've read coming up until now. And then I just have to reaffirm certain key things, make sure they've read through all the instructions, and then we can just do the procedure. Other people I see, as you said, either them or their partners, like really need some either fundamental information and want things to be described in detail, just even like specifics of the procedure or why. And then I definitely see a good number of people who just need some help thinking through the decision making about readiness and whether or not they're ready to choose permanent contraception or at that point in their life. And you're right, some people, their partners have an issue with it. And I love being a family doctor. I love having like welcoming patients to bring in their family or their partners to discuss things together with me and doing sort of like brief family therapy in the office. It's kind of a fun way to keep things different and change things up on a day-to-day basis. Not a lot, but it's like the analogy is when you're doing your post vasectomy semen checks and you see like 30 or 40 people in a row and you see zero sperm and you're like, it's not supposed to be that way. Like you're supposed to have some sperm sometimes in the post vasectomy semen checks, and if you're not finding them, maybe it means you're not looking hard enough. Or if you're not having people who can talk to you about their ambivalences or needing more time occasionally, then I feel like we're not open to having people being able to share that with us. We also don't make it very difficult to get in here. Like for us, it's easy to book and we don't have long wait periods. So for that, the fact that like I want to make it easy for people, I want to decrease barriers to access. But if you make it so easy, then there's always the chance that people have like booked 3 weeks before and maybe they actually do need time. So it's one of the things that you talk about is you have to be comfortable saying to somebody, you seem unsure. Do you want more time? Or I know you booked this appointment. I know we already did the payment at the front or whatever it was, or got your referral, but like we're here next week or we're here next month. Like, do you want to take some more time and store some sperm or talk to your wife or your partners or whatever it is, and then come on back? And yeah, so people like to hear that. And I think even knowing that that's an option makes people feel less pressured to do something that they're not quite ready to do.
The procedure itself is fairly easy for you now. How long would you say it takes on average for you?
I think at one point when I was timing it at one place I worked that it was about 8 minutes on average. And I haven't been timing in the last couple of years. Yeah.
That's so great. I mean, it makes men comfortable to know they're not going to be on the table very long. You know,
Yes.
that's
I think,
that's an
yes.
incentive in itself, just that it's quick, it's over and it's done. And what about follow-up? What do you do for follow-up?
For follow-up, we make phone calls. We still reach out to everybody a week later, and people are able to reach out to us in by phone or by email anytime they need to. We do our own in-house post-vasectomy semen checks with just a regular microscope here in the office. So we book the appointments when people leave, and we have a very high follow-up rate. Over 80% of our patients come back.
That's excellent.
Yeah. And then we also give options for people to do either at home or mail-in options as well.
If you were starting today, what advice would you want to give yourself, your starting out self?
Oh, I mean, I think it speaks well to where I am that I think I got to a good place. Like I think we're doing a good thing here. I think we're providing a service that's really making a difference to people, and we're doing it in a way that's sustainable for us for the most part. So part of me wants to just be like, get here, get where you need to be, and do what you did to get here. I would advise. I think it would. I'm the kind of person, and given the type of things that get bumps that get thrown under your wheels when you're doing your own practice in this complicated medical system, is I think having partners or people who have buy-in, who you can work well with, would be would be the one thing that I would really have changed, is to tell myself, look for someone who might want to do this with you and do it together with someone else or with a group of people. I think that would have been something to think about more.
And I
Then I
think
could have looked into becoming a nonprofit, which is just not too onerous for one person to do on their own, or it would be easier to expand services or have sort of
partners.
backup for time off and things like that.
What did you see after Roe decision here was overturned? Did you see an uptick in demand for?
Yeah, like all our colleagues in the United States, I saw a major uptick in people coming in appointments after the elections, after the presidential elections, which mirrored what happened when Roe fell after the Dobbs decision. We were very full for the several months after that, and then we've seen a pretty steady increase since the elections here, and continue to see people who, when we ask them why now? People are like, oh, I've been thinking about this for years. Finally, I'm in here. And I say, why now? Or, we'll say it's because of the current political climate and my concerns about my partner or partners not having access to their own um, healthcare needs, like whether birth control or abortion care, that the tolerance for the feeling like the need to do something and face this, do their own part to face this crisis that we're going through now. Certainly I've been seeing that, yes. I've also felt very motivated myself to make sure that I'm part of the people who are providing abortion care in my practice as well, because there's the more people who are just providing abortion care as a normal part of healthcare, the harder it is to target people who are doing that exclusively. As the way that people are being targeted. So I'm trying to make sure that we're a blip of camaraderie in that front as well.
Oh, that's excellent. Are you seeing also an uptick in younger people having going for the vasectomy because they don't want kids, making that
I,
decision earlier?
I certainly have been seeing more people who are younger and child free, both in my practice in Massachusetts and in the Planned Parenthoods where I work in New York. Um, what I don't know is how much this reflects the general trend or if this is practice specific, because I know that I'm listed as a place that people can go to, and I see people who've been turned away from other places. So one is like maybe there's like a lot of like referring other people in friend groups or social groups or online fora, but I do believe that this is a trend in general, and yes, I am seeing it. I the last time I checked, it was like 20% of my patients were under 30 or child free, and
Wow.
it may be more. I don't have the newer numbers.
What about the new technologies on the horizon for doing, you know, temporary vasectomies? Are you
Very
excited
exciting.
about
Very exciting. As much as I feel like this will complicate how to have discussions with people, um, it's the type of complicating that I welcome. I think one of the things that we talk about is there are very, very few options for people with testicles that work well for birth control. And the rub with vasectomy is that it's permanent nature, and that the younger you are when you get it, the longer that you've had it for, the less likely you are to be able to reverse it. So that's certainly something to consider strongly, but it's very exciting to see that there's even more than one option in the near future for things that may potentially be reversible, and just to see how people react to those. And if we build it, they'll come, but there are people looking for them. There definitely are people looking for these things. Yes.
Yeah, I am so glad about that too, because
Yeah.
it might, I think that if you're open to a temporary vasectomy while you still are thinking you might want children, you're
Right.
also open to a permanent vasectomy once you don't want any more kids.
Sure.
That's good for women because it really does take that burden away.
What makes me happiest at work is when I walk in having had a rough morning and the world and going wrong and everything's not right, and I come in a grumpy mood, and then I go into the room with a patient thinking no one wants a doctor like this, and then I walk out of the room and we're both laughing and having had a great time. I just think it's so nice, like seeing my patients and doing the right thing by them, and then they are happy about it, and it just sort of like it's the kind of thing that we feed each other. Like I make my patients happy, that makes me happy, and it really can. It's like going into a great sweaty workout, like where you go in for a nice massage. You go in thinking not feeling right, and you come out feeling better, and it's nice when you have a job that can do that for you. Yeah.